Feeling overwhelmed by the AGNP exam? Don't worry. Here's your 12-week roadmap to success. Let's walk through what to study each week. Week 1. Getting started. Your goal this week is to get familiar with the AGNP exam blueprint and content outline. Focus on clinical management, pharmacology, and health promotion. Start by setting up your study space, gathering all materials, and taking a pre-test. Week 2. Review core clinical concepts. Part 1. The goal this week is to dive into foundational clinical management and primary care topics. Focus on cardiovascular health, respiratory conditions, and neurological disorders. Use review books, online courses, and begin mixing in practice questions. Week 3. Review core clinical concepts. Part 2. Your goal is to continue building clinical management knowledge from last week. Focus on musculoskeletal disorders, gastrointestinal health, and dermatological conditions. Keep doing practice questions and use case studies to reinforce learning. Week 4. Deep dive into pharmacology. The goal is to master key medication concepts and pharmacological principles. Focus on drug classes, indications, interactions, and side effects. Create flashcards for high-yield drugs that often show up on the exam. Week 5. Health promotion and disease prevention. This week's goal is to understand how to care for special patient populations. Focus on geriatrics, women's health, and mental health in the primary care setting. Use case studies to better understand clinical scenarios. Week 6. Optional review or catch-up week. Use this time to review any missed content or reinforce weak topics. Week 7. Practice and application. The goal is to assess your knowledge and apply what you've learned so far. Focus on completing a practice exam to find your strengths and weak spots. Spend extra time reviewing challenging topics, especially clinical and pharmacology. Week 8. Advanced clinical management. The goal this week is to go deeper into complex clinical cases and advanced treatment plans. Focus on managing chronic conditions, using diagnostic tests, and understanding treatment protocols. Study common exam-tested disease management strategies. Week 9. Practice with question banks. This week is all about building stamina and getting comfortable with the test format. Focus on timed practice using a question bank. Aim for 50 to 100 questions each day and carefully review all explanations. Week 10. Refining your knowledge. The goal is to consolidate everything you've learned and sharpen your weak areas. Focus on reviewing weak spots from your practice tests. Keep drilling questions, especially on tougher topics. Week 11. Final review and strategy. Your goal is to wrap up your review and fine-tune your test strategy. Focus on reviewing your flashcards, textbooks, and summaries. Take another full-length practice test to track your progress. Week 12. Pre-exam prep. This week, the goal is to focus on strategy, mindset, and rest before test day. Focus on time management and avoiding common exam traps. Keep reviewing your key concepts, but make sure to rest and recharge too. By following this 12-week AGNP study plan, you'll cover all the essentials and stay on track. Remember, consistency is key. Need expert resources to pass your AGNP exam? Head over to LatrinaWaldenExamSolutions.com for study guides, video lectures, and more exam prep tools. You've got this. Like, comment, and subscribe for more NP exam tips.